Okay, so we're talking about glaucoma. So glaucoma is just simply what you're having pressure in the eyes. Okay, so actually we're focusing on what the different types of glaucoma. All right, so just simply pressure in the eyes, right? Could be fluid, right? Too much fluid in the eye, generating a lot of pressure and all of that. So glaucoma is not actually a single disease, right? It's like the big name for this different type of glaucoma. You understand? So it's actually what a group of eye disease that would possibly damage the optic nerve because there's pressure. Okay. So and the optic nerve is actually what essential for good vision. What you see with your eye, it is a connection between the eye and the brain. Okay. So this damage is often due to what? Abnormal eye pressures in the eye. Okay. Although it can actually occur with normal eye pressure as well. Okay. So now let's look at the types of glaucoma. We have the open angle one. This one is a place to pay attention to the types, right? Because there's no point discussing each of those glaucoma in a different video, right? Once we can just have the whole concept here. So that this is the most common type. This is where the drainage canal in the eye gradually become clogged over time. So you have like what a build back of fluid in the eye because there's no drainage. The canal is blocked. Okay, just like in our towns when we don't use a drainage system where we blocks, and during the rainy season we have flooding. Okay, then we have the angle closure glaucoma. This one occurs when the iris bulges forward to narrow or block the drainage angle formed by the cornea and the iris. So you can just have your anatomy what do you call it, atlas, and be seeing all these things I'm talking about. The normal tension glaucoma, so that the optic nerve damage occurs even though your eye pressure is normal. Pigmentary glaucoma, we say that pigment granules from the iris build up in the drainage canals, slowing down or blocking the fluid exiting your eye. Congenital glaucoma, this one is what a rare form. Anything congenital, you were born with it. Okay, so there's defect, you just born you like that. You have defect in what? Drainage of the eye system. That's the eye's drainage system, sorry. So symptoms, each different types of glaucoma have different symptoms, right? So open angle, there's eventually blind spots develop in the peripheral vision. For acute angle closure glaucoma, there's severe headache, there's eye pain, there's nausea, there's blurred vision, there's halos around lights. Normal tension glaucoma, there's gradual loss of what? Peripheral vision. Pigmentary one, you have blurry vision. Okay, mostly during exercise or after the exercise. Congenital one, we say that symptoms include are sensitive to light. You just be crying, tearing, okay? Cloudy corneas, okay? So causes and risk factors. If you have high like things that will predispose you to developing a glaucoma, if you have high intraocular pressure, which is usually about build up of aqueous humor, it will definitely develop a glaucoma. Age, it's more common in older adults. Family history. So there's a higher risk if your close relative have glaucoma. Certain medical conditions like if you have diabetes, high blood pressure, heart disease, all of these increase the risk. Eye trauma or certain medications, all of this can actually lead to what? Glaucoma. Diagnosis is just what comprehensive eye exams, including measurement of what intraocular pressure, that's what tonometry, visual field test, imaging test of the what optic nerve. Treatment is we actually just give medications, eye drops, laser treatment to improve drainage, surgeries. Okay, so that's it for what glaucoma.